Good morning, everybody, to another episode of the Seamless Connection podcast. I have with me today Joanne Mizell from Banner Aetna. She's the Chief Operating Officer and has been with both Banner and Aetna for a number of years in a number of different roles. And so I'm super excited to have her with me today. I'm going to let her introduce herself with her rich background and history, both on the professional side as well as her many interests outside of work. And then happy to dive in. Joanne?
Thank you for having me, Mina. So, yes, Joanne Mizell. I am currently with Banner Aetna. We're a joint venture between Banner Health, a large health system in Arizona, and Aetna. And I've really been in this industry my entire life. It feels like even starting back when I was in high school, I had a part-time job working for a health payer. A lot of change in that period of time, a lot of complexity and a lot of improvements. And I have really seen so much growth in the industry and in networks being added and in the way that payers interact more with members beyond submitting claims and processing bills. So it's gotten really complicated, and I think my passion is really around finding ways using my knowledge of the industry to make it better. And if we can start making it better at our company, then others will follow as well.
And how do you define better? I know everyone has all their different complaints. Healthcare has all its warts, as we all know. From your perspective, what are the biggest pain points, and where do you think the biggest opportunities are to make things better?
There's so many areas. So it is better. The coverage is better. There's more provided right now. But when I say better, I'm thinking about the member experience. So, which is also the patient experience. And the biggest thing to tackle is while there's so much improvements and technology and better care available, it's really confusing, and it's hard to make it not confusing. And that's kind of my challenge, and what I am very interested in is figuring out how do we make it easier for members to understand what they have available to them at the right time when they need it, and not feel like it's Big Brother, but it's actually someone trying to help them. So that's it, kind of taking away some of the mystery and some of the confusion in interacting with the complex health system.
Yep. And you had left Aetna earlier, and you came back to take on this new role and this new challenge. If you don't mind me asking, why did you leave earlier? And I think we heard a little bit about why you came back, but is that related to why you left? And then kind of what is your hope for what you do as you come back now?
Yeah. Great question. I retired from Aetna in 2011. And had a great career, and was fortunate to be able to do that at a relatively young age. Realized I wasn't ready for retirement, and did some other things in our industry, and got involved in some community and affairs areas as well, and really expanded beyond that. But I wouldn't have gone back to Aetna. It's Banner Aetna, the joint venture that lured me back in. Aetna is a really big company and has so much to offer. But when you have a really big company, it's hard to implement change. It's hard to really make quick improvements and to test things out. And the benefit of Banner Aetna, which is half owned by Aetna and half owned by Banner Health, is that we are a separate company. So not a subsidiary of either. We're a separate company, separately licensed. And, we've been charged by both of our owners to simplify and make the healthcare experience easier and better and more affordable for members. So that appealed to me. I've done, work with homeless in our area is another passion, helping folks that really are underserved. And, realizing that even if you have really good coverage, it's confusing and you might not use it. And for those who don't, a lot of times it's because it's too expensive. So I saw the opportunity and was given a lot of flexibility in how to create change. And we have the support of both owner companies, and it's been something that we have really focus on every single day. So it's how do we make the member experience better? How do we make things better? And better means easier to use and more affordable for members.
No, that's great. If you think about how it works from a patient perspective, 'cause it sounds like, and that's kind of what you're kind of immersing yourself in every day, is that from an employed patient perspective? Is that just kind of your average patient? Is that a rural patient that maybe isn't in Phoenix or, Flagstaff, a major city, but maybe a couple hours away or maybe on a reservation? I don't know if you guys actually cover, which geographic areas you cover, but I know Arizona has a lot of dense areas, but it also has quite a bit of rural areas. And,
Right.
and that's, from my perspective, covering hospitals across the country, they're like night and day, right? So the same solution doesn't work in both. So I'm curious how you meet that challenge and how you think about, the different patient populations there.
Right. When I started with the company 5 years ago, we did work with employer groups in Arizona, and we are statewide. So we do cover the entire state. In 2022, January 1st of 2022, we did also enter the individual healthcare marketplace. And so are working directly with members that are individuals and families as well. And that gets into some of the more, underserved areas. And we're in a couple of rural markets as well currently with our individual product, as well as our bigger product for employers. And yeah, you're right. That there's a lot of rural areas where it's hard to access care because you don't have access to big systems. But, I think one thing that we saw during the pandemic was we had to kind of pivot to more virtual care and more telemedicine and having health systems reach patients in a way where they're not seeing them face to face and they're not in the same location. And I really think that that's, if there's anything good to come out of the pandemic, that was something very positive that, out of necessity, new ways of interacting with patients were created that now created a pathway to doing more and more. And by that, I mean, things like if you're out in a rural community and you need to get follow-up care for your diabetes, a lot of that is really getting your blood work and having a conversation with your physician. And so much of that now we realize can be done virtually. So you don't have to just get the guy that's held up a sign down the street and says, I'm now your doctor because I'm local. You can really use providers anywhere. So I think that's really opened and blurred some of the boundaries, the geographic boundaries.
Can you talk me through? So personally, I'm here in Northern California. I'm part of Kaiser. So for me, when in talking about kind of smoothing the way, it's kind of the dummy's guide to healthcare. I log into my kp.org. I pick which appointment I want. It shows me the appointments. I click book and I'm done. Right. So to your point, it's very easy. I can't mess up even if I wanted to. And I know that that's probably, that ease of simplicity is probably what you're shooting for all your patients.
Yes.
All your members. What are the biggest barriers to that today? Can you walk me through what it's like today versus what you want to get to? What would be your ideal? Like, let's say I'm a patient and I want to be I'm that diabetic patient you just talked about. And I feel like maybe my sugar is out of control. What would I have to go through today to get tested, get treatment, get counseling, get nutrition services, whatever is involved with that,
Yeah.
versus what would be your vision for how to do it right?
Yeah. So that's a perfect question. Thank you for asking, because we have actually have found the solution to that. No matter where you live, if you have internet connection, we have a solution. And we did implement last year in 2022 a diabetes reversal program through a vendor. Verta is the vendor. And it's essentially, except for going and getting your blood drawn, it's all done virtually. And it is such a powerful program that it's not about controlling your diabetes, it's about reversing it, which we now know is possible. We see our members reducing their A1C. We see them losing weight. We see them coming off medications, not just reducing their doses, but coming off diabetic medications. And that program has just been a godsend to so many of our members. And we actually have them frequently come to us when we are at meetings and presentations and say, this changed my life because I now feel like I have a future. And it's my future is not diabetes. So that is one way that we have used, no barriers based on geography to address a serious chronic condition like diabetes.
Oh, that's fantastic. And is that something that a patient is directed to based on their medical record or something when they sign up, or they have to opt into it? How does, to your point of making it easy to get care, how do they know that this is a tool available to them?
We tell all our members about the program and how to reach us if they or a family member have type 2 diabetes. But we do also, once we know that someone has type 2 diabetes, which is easy to tell from their prescription drugs, right? Insulin and so forth. We do reach out to them, tell them about the program and the benefits of the program to bring them in. And that's where we probably get most of our enrollment, is when we actually make that outreach and say, hey, this is a program we think will benefit you. And it doesn't cost anything. Another benefit, a barrier to care is cost, out-of-pocket cost. It costs them not a single penny beyond, what they're paying for their premium to participate in the program.
Oh, that's fantastic. That I didn't know actually that was part of it. That's such a great option. Do you see the potential for this? So this is bringing virtual care to have a huge impact on a specific subsegment of your population. Do you see what other opportunities do you see in terms of other chronic conditions or other specialty areas, whether it could be, long-term, I don't know if dementia or, Alzheimer's is one. That's a huge cost area, a huge talking point for a lot of people these days as the population ages. Cardiac conditions, end-stage renal disease and chronic kidney disease. But there's lots of others. So I'm wondering if this is kind of the tip of the iceberg for you in terms of the disease indication you perhaps started with, or if there's already others you've rolled out or that you're looking at to approach virtually for your member population.
Yeah. So we also use a lot of virtual outreach and virtual treatment for emotional and mental well-being services. It's really hard. There's a growing need, and it's hard to get appointments. There's just not enough practitioners. When you have to make an appointment and go there and have a wait for someone to get the same person every time. Virtually, if it doesn't matter where they live in the country and they can treat you, we have implemented about 12 different options for our members to have virtual mental well-being services, from depression to adolescent issues to eating disorders, and even those who intend to harm themselves. So we have connected people that way, and that's a really big need. Another one that really grew during the pandemic, and we think that virtually is a way that people feel comfortable making those connections. So that's a big one for us. The very first one we did was for just primary care. We do offer, again, getting at trying to keep costs low for members. So you're paying a premium. We want as much as possible to have you not have to pay unless there's something serious going on. So our virtual care process is text-based, it's on demand, and it's free. So you don't have to get out your credit card to have a visit. You just have it on your phone. You have your visit. The doctor can send prescriptions to your pharmacy. They can send lab orders, call you back in, and it's really a nice way to supplement the in-person care when you have geographic boundaries or cost boundaries as well.
And I have to admit curiosity from a physician perspective, given I'm the head of for a medical group here. How does that work from the physician side of things, right? So it's no cost to the patient, but how is it sustainable economically from a physician perspective? Because one of the issues we've seen, again, across multiple hospital settings and clinics, is during the pandemic, a lot of needs were met in a non-sustainable manner, if you will, right? And to make sure, and we all know that margins are terrible in healthcare, especially in the hospital setting and for physician clinic settings. So how does that make sense, or how can we make it a sustainable option for physicians? So for example, to attract, we know psychiatry, as you mentioned, it's a really hard field to recruit in, even for us, right, as a group. And it's a really hard field in particular to have physicians accept insurance for. And so versus a cash pay situation, so which is a sad state of affairs, but also contributing to the access problem that you mentioned. Do you have any thoughts there in terms of both what's causing the issues and also potentially how we make it work for the physicians as well as the patients?
I think, well, let me answer that in two ways. So our solution, our virtual care solution that I just mentioned, that's no cost to members, there is a cost to us as the payer. So we pay for the service. We just have created an environment and partnered with an organization, 98.6 is who we use, that also aligns with our belief that people should have access to primary care without money being a barrier and the cost being a barrier. So through that relationship, we pay the vendor. The vendor employs the physicians, so it's not contracted. They employ the physicians, and so our members, when they access this care, they're able to do it at no cost to them. So that's how we do that. And then just I think the bigger picture around some of the other services, behavioral health is not part of that. That's primary care, and there is cost to that. But I think that the more we see virtual visits taking place, these providers aren't going to have a need to have brick and mortar to see their patients. And that's a really big cost, right? And the office staff and everything that comes with it, and the waiting room and the snacks waiting for your visit, things like that. That's a big overhead savings for providers. And I think that once providers are business people as well, and they can figure out how to be more efficient and probably see more patients in a virtual environment than they can in a physical in-person environment, and reduce some of those other expenses, which will help bring it down, I think, a little bit.
No, that makes complete sense. And when we talk about access, you mentioned earlier in terms of some of the markets having potential network adequacy issues, and not necessarily for Banner Aetna, but just in general, right? There's patients all over the country, all over Arizona, that are not necessarily the easiest to reach places. Have you seen this in person? Like, do you have personal experience yourself of someone in that situation and how it was able to be fixed or not fixed, as the case may be, through virtual care or maybe through expanded local clinics or expanded local lab work or whatever the different options might be?
Yeah. I don't have personal experience with that, but we do have a cabin up in a rural county in the state here, and I do hear from people that live there. There's a hospital, a community hospital in that area, but they have to come down to Phoenix if they need any kind of care. And you mentioned end-stage renal disease. That's a lot of back and forth and things like that. So I think that one thing that I have seen is more of a commitment from the larger systems, including Banner Health, to invest in some of those rural communities, and so that they don't have to be coming back and forth. Like dialysis in some patients can be done at home, and getting that set up so that they can have that that done at home and not be going back and forth, a couple times a week to get their dialysis. There's also, like I mentioned, the virtual access to specialty visits, and you can get, the best specialists in the state or the country to have a virtual consultation with you. And in most diseases that aren't, acute, where you have to cough for me and that kind of thing, or I need to feel you. They're really consultations in history and understanding what that patient's going through. And the technology now is so much better to enable that. And the willingness by health systems to do that, I think, is really opening it up for everyone, but especially in those rural communities.
If you had to pick one item to say, hey, this is kind of my bugaboo, my big kind of pain point for me to provide that seamless healthcare, that seamless connection to my members, what do you think that still is today?
If I knew and if I really thought there was one thing that could do that, I think that's, unfortunately, there's just not. It's too complicated. It's far too complicated for there to be one thing. So we're looking at the biggest pain points and that we hear about, and addressing those. We just implemented, for example, one thing that drives people crazy. They know they have insurance. They go to get health care, and then they start getting bills and explanation of benefits, and they have no idea how to reconcile them because they don't make sense because they're talking in different languages. We just implemented, to address that, something we call frictionless billing, where we connected and partnered with Banner Health to create a single statement. So we're not asking these members to reconcile and figure out their bills and their EOBs and what they owe themselves. It's a single statement, both of our names on it. Insurance and health system agree that this is what the payments are. These are the discounts. This is what we paid. This is what you owe. This is what you already paid. Here's how you can set up a payment plan in one statement. So that, seems like a simple thing to do. It wasn't. It took us 2 years, and that's with a partner that is, highly integrated with us. But it's a huge benefit because, when people are sick, that's a hard thing to have to deal with, is figuring out the financial part of it.
Oh, completely. That's the last thing you want to think about,
Mm-hmm.
right? How am I going to pay for it? You just want to get through it.
Yeah.
And I completely understand having a consolidated statement, the ease of that, just saying,
Yes.
hey, what's the number at the bottom that I need to,
Yeah.
what am I looking for?
And that both are going to agree. If you figure it out, then the sometimes the provider will say, no, that's not right. Or they don't always align. And that's, I think, the benefit is they align. We're telling you, this is your single source of truth, and this is the bill.
Oh, that's fantastic. Last couple of questions, and I'll let you go. As you think about your time with Banner Aetna and all the changes you've done working for the good and the access of the members, which is amazing, what would you consider, what are you most proud of? What do you consider your biggest success?
I'm most proud of the things that create, actual joy in our members, that they express to us, that they are so pleased. They're always pleased that you paid their huge medical bill, but when they tell us that we went above and beyond and changed their lives, that those are the things that, to me, I'm most proud of and find most rewarding. Because that's why I came to Banner Aetna, was not to do just more typical insurance stuff, but to make a difference in people's lives. And that's what I'm most proud of. And we've done that in a number of ways, working with Banner Health and bringing, clinicians in to help members, to walk them through complex situations. And I mentioned the diabetes reversal program. We have a program called the Banner Aetna Kitchen, where we invite people in to learn over a 12-week period how to cook healthy and how to shop for it. And they cook and they have a meal, and we have a dietitian talk to them, and they ask questions. And that opportunity gets them connected with other health practitioners that might provide them with some assistance. And they eat it up because it's not about medical care. It's about help me just be healthy. And I've tried to lose weight before. I've tried to do these things before, and I can't. Just help me, and that's what this program has done. So, things like that. Just and frequently we have people say, "You have changed my life. This program has changed my life," and that's pretty rewarding.
Yeah, no, those are the ones that stick out to me too when I get a patient story. Like, thank you for X, right? Whatever that X happened to be. Is there a particular patient story or member story that sticks out in your brain that you're able to share with us today?
There's one kind of recent one that sticks in my mind just because I just heard about it yesterday, and it's in our program that's our multidisciplinary care team, which is very long. We call it MDCT, where patients that have complex care needs or they're having difficulty following the protocol for whatever condition they have, and and so we have all kinds of practitioners on this team, and that's all they do is work with our members to help them. And this particular one, the member was having a very difficult time taking her medication properly, and she had, I don't know, 7 or 8 different medications because she did not have a good grasp of the English language, and she did not read well at all. So she had a lot of trouble with that. So there's some, embarrassment that comes with that as well. And we couldn't figure out why she was having, wasn't complying with her medication protocol. And the pharmacist, in talking with her about it, kind of got this information, and they figured out a way to color code her medications. So instead of having names on them and what they are, everything was color coded in a way she could understand it. And we had the pharmacy fill them. All of her refills are now coming to her in this color coded bottles, so she knows what to do. So that sounds super simple. It's a super simple solution that costs nothing, but taking the time to help that person, with the limitations that she had, to be able to become healthy.
That's amazing. And actually, I'm actually surprised you say it costs nothing, because I'm just imagining all the new labels and the colors and like the protocol versus just shipping out your
Yeah,
typical prescription.
yeah.
But that's amazing.
Pharmacies are willing to do what they need to do to keep those members. So yeah,
Oh,
they should.
that's amazing, and that's actually a new one. I haven't heard that type of story where it was a communication issue, but it was such a simple solution. I haven't, usually it's like a translator's brought in or
Right,
something. So
right,
that's
right, right. Some people can't read though. We know
yeah,
that, and
yeah,
they're the ones that have the hardest time in with healthcare literacy in general.
yeah. And what I love about this story is that it's an ongoing, permanent solution. She's not going to need someone to support her on an ongoing basis. She now has a way that she can take care of herself,
Right. But
which
at
is
the
lovely.
same time, she knows that she has this person, she has this team of people that's there if she does need them, and they'll check in on her to make sure it's
Yeah.
still working for her well.
No, that's great. That's fantastic. And this is part of the virtual solution, or this is an in-person kind of
This
situation.
is our MDCT is it's at the choice of the member, face to face or virtual, however the member prefers to interact.
Okay, perfect. And then the last question I had for you is the flip of that, which is what's been your biggest challenge or your biggest kind of frustration point in the last couple of years as you've taken on this new role?
It's a challenge. I don't know about how frustrating it is, but it's a challenge we're trying to address, and that is when we have these great programs. The one that helped this member I just mentioned, the diabetes reversal, the learning how to eat and cook healthy for yourself and your family. We create and we develop these programs, and and we send information multiple ways, by mail, by email, by text, to members, and it's really has always been, and I think will always will be, a challenge to get that member at the moment they need something to read it and to engage. So engagement is, I think, the biggest thing for us. We have these great programs, and if everyone eligible for them and everyone who could benefit from those programs did, their lives every day would be better. And it's finding that holy grail of engagement, how we get them to read, to understand, to know, and to accept the help.
Yeah, no, completely agree. I've seen this time and again in healthcare. I'm sure you did too, which is you can have the greatest solutions since sliced bread, and if you can't get anyone to use it, it doesn't matter.
Yeah. Yeah.
Yeah.
And so often they'll say, oh, if I had known that we had this, I would have done it a long time ago. And we sent you 30 emails. But we get so much information, we're on information overload. So
Yeah.
you absorb what you need in the moment.
Yeah. No, that's exactly right. Well, thank you. I know we're actually at an overtime. I thoroughly enjoyed talking to you and hearing more about this. And I love the impact you're making for your members on a day-to-day as well as ongoing basis. So thank you for sharing that and your time with us.
Thank you. Thanks for having me, Mina.